Selamat pagi, everyone. Very good morning to all our Rotary dignitaries, Rotary leaders, SIBIAM members, our medical professionals, and friends of the Spina Bifida community and members of DASH. A very special welcome to our guest of honor, our District Governor, Dato Bindi Rajasegaran, Rotary Club of Greentown, and also our District General Secretary, Moti, is here with us today, as well as our District Rotary Foundation Chair, Past Governor Siti Zubaida. And also let me acknowledge the presence of our various partners of our global grants. We have from District 3310, they're not in the room yet, our DRFC Past President Dr. Shahul Hamid, and also we're expecting immediate past District Governor Raja Mohan from Rotary Club of Pandan Valley to come in and join us later. Of course, from Indonesia, we have the District Rotary Foundation Chair, Past Governor Iva Kurniati from Rotary Club of Jakarta Sunter Centennial, and unfortunately IPDG Rosie Viguna from Rotary Club of Jakarta Metropolitan is not able to join us today, and she extends her apologies. And we have the presidents and representatives from the two clubs from India, from the Rotary Club of Anandakrishnan and from Chennai Towers, and we hope later on they'll be able to engage us as well. And we have with us as well the president of the Spina Bifida Association of Malaysia, or call it SIBIAM for short, Professor Dr. Amara Naysaduray, who will be engaging us in a session later on today for our launch. And right more on home ground, we have with us our very own chair of this whole exercise of the District Action Group on Spina Bifida and Hydrocephalus, or the acronym DASH. We have immediate past President, Dr. Kribanandan Naidu from Rotary Club of Damansara, as well as our co-chair, past Assistant Governor, Dr. Selva Kumar from the Rotary Club of Melawati, and who is also the Vice President of the Malaysian Paediatric Association. And with us, we have also our local partners from the various clubs from Alpha Ampang. We have Damansara West, we have from Melawati, we have from Rotary Club of Ipoh, Penang, and Rotary Club of Singapore. Right, so with those few words, later on I will acknowledge more Rotarians as I go along. And we would like to now basically present to you this very unusual launch. Why do I say very unusual virtual launch? It's because we have some quizzes for you, we have some poll questions, and also we have visual summaries. Now let's kick off with the first poll question. If you could care to answer these questions, which of these describe you best? I'm a Rotarian, or a person with SB, or a parent of a child with SB, or I'm a healthcare professional, or others. You can type in the chat if you belong to the other category. So please submit that. We'll give you a few seconds to do that. And whilst waiting for you to submit those questions, I would like to once again emphasize that we have a visual summary. Now, this is a unique feature of our launch this morning. We have Tikka, Ms. Tikka, who is with us, and she will summarize at the end of some of the sessions, a visual summary of what has been done. Yeah, so we can see this is all very, very visual. All right. So tech team, are we ready for the poll results for the first round? Poll question number 1. Okay, more than half of us here are Rotarians. You got 7% of the members of the SB community, either a parent or a person with SB. Welcome to this global grant launch. Oh, I'm a healthcare professional. That's 34%, and others. We'll check what they are. All right, thank you so much. And this global grant number 1980839 is essentially to spearhead or to assist the members, the community of the SB community, and to train healthcare professionals as well as caregivers in making their life more comfortable. Yeah, this is a very unique global grant. It's possibly one of the very, well, probably the only global grant for the Spina Bifida community. I can probably say on some authority on that because I've not seen any global grant on the SB community. So this is truly a unique occasion. Right, without further ado, I'd like to now move on with the animated introduction. Have you done that, Tikka? The animated introduction? Oh, sorry, that was already done, yeah? That animated introduction. Okay, great. Now we have the welcome address, opening by Chairman of DASH, immediate past President Dr. Kribanandan, who has been working very hard in getting our action group going, and also this global grant together with members of SIBIAM and our partner in the Rotary Club of Damansara has been working relentlessly in getting this through. All right, and now we have the, is that the visual on? No, it's not. All right, Kriban, over to you then.
Your mic is on mute.
Muted, Kriban. Yeah.
Okay, let me start again. Sorry.
Yeah, please start again.
Thank you. Thank you, everyone, and welcome to today's session. I believe all protocols have been observed, so let me begin. Firstly, I think I need to recognize PDG Leslie Salehuddin, who has done all the introductions and salutations, but of course, no one has introduced him yet. It gives me great pleasure to welcome and thank him for his continued and steadfast support to DASH, the District Action Group on Spina Bifida and Hydrocephalus. We are indeed very blessed to have him as an advisor, and he's been supporting us over the last few years and continues to provide an inspiration to the group. So without further ado, let me begin. We would like to we'd like this event today to be a bit more than just a launch of another global grant. We want to start the awareness process here and now, as I am sure many of you are not familiar with this condition and its ramifications. We also hope to give you a sense of why this is such an important moment for the Rotary Club of Damansara, for DASH, and also, of course, critically for the Spina Bifida community in Malaysia. We have been involved with the SB community for over a decade, and the partnership with SIBIAM, the Spina Bifida Association of Malaysia, has been filled with many meaningful engagements and, of course, very many positive impacts with the afflicted individuals as well as their families. It was this relationship which actually made it possible for us to undertake this very comprehensive community assessment, which was a prerequisite for applying for the global grant in the first place. And this connection has been very important in that sense. We received confirmation to proceed with the global grant within a month of our submission. This was largely because we were able to provide a very succinct picture of the community needs, and also to demonstrate the sustainability and long-term impacts, which of course is required as far as the global grant is concerned. The project itself aims to raise awareness of the Spina Bifida condition by identifying the training of key healthcare professionals, and then also special needs teachers and also the caregivers. So the question is, how are we intending to do this? So our starting point was to understand the SB condition. And of course, in the next segment, Professor Dr. Amara Naicker will give us a bit of a background. And I think that's going to be quite important to just understand what it means to be an SB. The next point in our engagement is really with the doctors and key healthcare professionals who are basically putting their years of experience onto paper in this first phase of our program to help us create basically the training manuals, which we are going to use to train the trainers and then send the trainers out in phase 3. So we are really very indebted to the pool of very passionate doctors and healthcare professionals who have volunteered their time to help us to do this. And that process has already started, and part of our phase 1 engagement we hope will be finished by about September, and then we can go on to the next phase. So I think the key issue is, why is this important? You may ask, simply because I think it's basically widening the experience base and creating a level of care for Spina Bifida clients, which is consistent and encompasses the best practices as we know it today. We'll be taking the experiences we have in different parts of the country to provide a consistent and a nationwide offering in terms of the training and the experiences. So the first phase 2 of the project, we will be using basically the training manuals, which we have prepared. And then we intend with this exercise to establish a pool of resources who will eventually fan out to the different regions of the country to spread the awareness of and knowledge about the unique requirements for SB patient care. It is during this period, i.e. phase 3, where we will need to engage with all of you, the Rotarians, on the ground to run these awareness workshops, which we will be targeting not only the healthcare professionals in your area, but also caregivers and persons with spina bifida. So I think there's a lot to be done, and I hope we can engage with you in this process. Later this morning, we will have a forum where we will hear about the challenges of being born with SB and also the triumphs of some of our SB members who have risen to lead meaningful and successful lives against all odds. You will also hear from our doctors about the complexities of the care needed and why a multidisciplinary medical approach is so much needed. I hope that by the end of today's session, we will begin to appreciate why this condition is so unique and why it requires such a high level of intervention and why this global grant is so important as a start to making a difference. So firstly, I hope you, finally, I hope you agree that these are very compelling reasons for being part of this journey. And so without further ado, I would like to invite Professor Dr. Amara Naicker to tell us something about the spina bifida condition and how it presents itself. Professor Amara, over to you.
Okay, a very good morning to everyone. And are the slides up?
Yes.
So, so spina bifida is a very complex situation, and it comes under this broad condition called neural tube defects, which involves very severe birth defects to the brain and spine. So, and although they can have very varied clinical outcomes and often mortality is quite high, the spina bifida subtype is luckily commoner and has the best chance for survival. So what really happens? During development, due to various reasons such as genetic or deficiency in some nutritional components like folic acid, B12, and some environmental factors, the primitive spine fails to undergo complete closure, leaving a defect which the spinal cord coverings and sometimes a part of the spinal cord itself may protrude. So this whole process, unfortunately, happens within the first 4 weeks of conception, even before the mother knows she's pregnant. So, so that's why education and awareness for women in childbearing age is important for at least some level of prevention. And do we have any numbers? Well, worldwide, it's about 1 to 2 per 1,000 live births. In Malaysia, we don't really have a national registry or a recognized database as yet. So based on a very small study in a single center, it seems that we could be having anywhere between 2 and 9 per 1,000 live births. So the clinical presentation can vary according to the severity of the condition. Spina bifida occulta is usually mild without much physical issues. However, meningocele and myelomeningocele can be more severe, needing more ambulatory aids and sometimes even being confined to a wheelchair. So is there a cure? Well, for now, no, but studies are underway for effective prevention and treatment. But what we do know is consumption of folic acid-rich food, folic acid and B12 actually, rich food, as well as early supplementation with folic acid and the B group of vitamins prior to pregnancy can at least help to reduce the risk of neural tube defects by about 70%. So what are some of the issues faced in spina bifida? So hydrocephalus is something that we do see, and this is where the brain is filled with fluid. And so the neurosurgeon comes in very early on to see if he can try and fit in a BP shunt, ventricular peritoneal shunt, to try and drain the fluid, thereby reducing the risk of other complications like mental retardation, learning difficulties, speech, and swallowing issues. They can also have spine problems leading to scoliosis or kyphosis and foot deformities. So all these can make it quite challenging for them, to mobilize, and they will need rehabilitation. They may need orthotics, and they may even need some corrective surgeries from time to time. And due to this neurology, they tend to have a limb weakness and therefore obvious challenges in mobilizing. So you can see, sometimes they just need a simple orthotics and they may still be able to walk. But other times they need more extensive bracing and then additional walking frames, crutches, and even wheelchair usage. In addition to that, they can also have neurogenic bladder and bowel incontinence, needing alternative methods of evacuation, like catheterization for the bladder and enemas and suppositories for the bowel. They can also have ulcers and wounds over their leg, feet, and buttock region. And for this, we need to come up with a comprehensive program of wound management that can include some wound care products. It may include surgery to clean up the wound. It can include some orthotics with paddings to redistribute pressure over the feet so that the wounded area doesn't continue to suffer pressure. And it may also include specialized cushions that the wheelchair users may need to use to overcome pressure over the buttock region. So you can see there is an immense number of interventions and medical health that's needed. So they need to have their infection, urinary tract infection, pressure ulcers, and bladder and bowel management by the peds and medical team. And then we need surgical interventions like VP shunt, spine surgery, defect closure, foot deformity correction surgeries, bowel bladder surgeries, pressure ulcer management, and sometimes with even plastic surgery. And they also need rehabilitation, ongoing rehabilitation for their overall well-being, as well as to prevent musculoskeletal complications. They will need physiotherapy and occupational therapy to strengthen their muscles and bones and to carry out all their activities of daily living. And as you can see, they also have a range of equipments that they need to assist in their day-to-day function. And unfortunately, these devices will need to be changed or upgraded as the child grows bigger. So if all this is not enough, along with their pre-existing problem, like all people who are aging, they can also get diabetes, hypertension, and heart problems. They can have obesity due to prolonged immobility. They can suffer social isolation and depression. They can have issues with puberty, fertility, and sexuality issues. And it can be quite distressing when you have no one to talk to. And they can also suffer what we call secondary overuse symptoms, which is overuse and wear and tear to the joints, shoulder, elbow, wrist joints, and even to the lower limb joints from chronic usage of crutches and wheelchairs. So obviously no one doctor or allied health personnel can sufficiently manage from childhood to adulthood and beyond. Thus the importance of a multidisciplinary and holistic management for a more coordinated and systematic care delivery. So in summary, life is not a bed of roses for persons with SV. They face challenges in terms of their health, in terms of access to education, workplace, public transport, and even public places, and also poor social acceptance and sometimes reluctance on the part of the community to integrate with people with disabilities. So is it all gloom and doom for children with spina bifida? I don't think so. But what I do think is with the right support from the parents, healthcare professionals, and community, what they are born with need not determine what they can become. So yes, we can all come together to do our part in various ways, which can potentially help give them a fighting chance for a life, for a future that is going to, a future that can be bright for them. So with that, I would like to thank you.
You're muted, PDG, Leslie.
Thank you so much, Professor Amara, for the Spina Bifida 101 to sort of demystify a little bit of that for all of us. Now, later on, we'll have the panel discussion and we have time for Q&A. But let me now very briefly introduce our next presenter, our President, Lieutenant Commodore retired Shandra Das, who's been very active Rotary actor and also was a group study exchange member. So he's got Rotary in his blood. So over to you, President Shandra.
Thank you very much, past District Governor Leslie. Good morning, ladies and gentlemen. SIBIAM was founded under very humble beginnings and limited resources in 2007 by two dedicated and determined persons. One, a doctor, and the other person, a lady herself, unfortunately afflicted with Spina Bifida. Now, Rotary is an international organization. Among its 7 areas of focus, saving mothers and children is one of the mainstays of our commitment to action. Now, we all heard the details of this debilitating condition from Dr. Amara. SIBIAM initially underwent a 3-year struggle on its own before it was joined by the Rotary Club of Damansara in 2010. This partnership became a valuable long-term relationship, resulting in more fundraising efforts and member activities to take place. Rotary Club of Damansara's efforts increasingly led to more Rotary clubs to become actively engaged with the SIBIAM. This initial loose grouping then led in 2019 to the firmer formation of the District Action Group for Spina Bifida and Hydrocephalus, better known as DASH. Further attempts to source funds resulted in DASH successfully securing a Rotary International Global Grant in 2020 to meet some aspects of SIBIAM's endeavors. You did hear on the different phases on how these funds are going to be utilized from immediate past President Kriban. We know we still have a long way to go, but I state here that just like our commitment to eradicate wild polio worldwide, we in Rotary here are committed to be here for as long as it takes until all SIBIAM's objectives are met. Thank you. We will now introduce a video for the next segment of this morning's section. Thank you.
President Shandra, before we play the video, could I just interrupt and just quickly introduce that we have in the room today, Governor Captain Bindi from District 3410 has joined us, as well as, let me just acknowledge the presence. Captain Bindi, welcome. Selamat datang.
Thank you very much. Good morning. Thank you for having
so much
me.
for joining us. And also, I have overlooked in acknowledging the presence of our past Governor, Dr. Bhaskaran, as well as District Governor-elect, Dr. Krishna Kumar. So with that, thank you so much. And over to the video. All right, let's have the video then.
Hi everyone, my name is Kriban and I'm the chairman of DASH, the District Action Group for Spina Bifida and Hydrocephalus. It gives me really a great pleasure to be able to address you at this very important meeting. To start with, our journey with the Spina Bifida community started at RCD, the Rotary Club of Damansara in 2010, when Dr. Amara Naicker and Yang Mi Eng, founders of SIBIAM, the Spina Bifida Association of Malaysia, attended one of our regular Thursday meetings. Yang herself, a person with Spina Bifida, and Dr. Amara, a rehab physician, were able to synthesize the issues affecting the SP community and make a strong case for assistance. It moved me enough to take a keen interest. And so the engagement started. And before long, our club was firmly behind this initiative. This has been very much an all-round partnership. Our initial inputs were into organizational governance, attending AGMs, and organizing family days. But it was really the meetings with the wider SB community and understanding the complexities of the condition which really moved us to further action. the thousands afflicted by this condition, and we are the only body corporate in the country that provides assistance both for the affected and their families. We therefore fill a very important vacuum in this regard. From 2013 to 2017, we became actively involved in raising over 350,000 in corporate and private donations to directly support the SB families and to raise awareness of the condition nationally. But by 2018, I, for one, had a growing conviction that the SB initiative required a much wider reach than one club could provide. With a few RCD members in tow, we conceived of an initiative to take this to district. This culminated in the recognition of DASH at the district conference in May 2019 by PDG Dr. Bhaskaran, who was quick to recognize the importance of the service stream once we had a chance to engage with him. As far as we know, this is one of the first sustained SB initiatives of its kind through the Rotary movement worldwide. Here we are today at the cusp of something much larger with the award of the Global Grant. The project aims to raise awareness of this condition and develop a pool of resources to build a truly nationwide support base for the Spina Bifida community. I'm so glad that the small connection in 2010 with two passionate individuals has blossomed into a much larger collaboration. Now with the Global Grant in place, we have a true opportunity to take this relationship to another level. At the moment, the SB community only have SIBIAM and us to turn to. So come and join us, make a difference. We need all the help we can get, and there's much to be done. Thank you.
Hi, I'm Professor Dr. Amara Naicker Naysaduray. I'm a consultant rehabilitation physician at Hospital University Kebangsaan, Malaysia. I have been caring for persons with spina bifida for almost 20 years. I'm also the current president of Spina Bifida Association of Malaysia, otherwise known as SIBIAM. SIBIAM is a non-profit organization whose main objective is to look after the interests of children and adults with spina bifida and its related disorders. SIBIAM began its journey in 2007, and as founding members, our past president, Ms. Yang Mi Eng, a dynamic SP person herself, and I faced many challenges. We had insufficient resources and poor participation from parents who were themselves struggling to cope. The opportunity to connect with the Rotarians at RCD in 2010 turned into a valuable long-term partnership. They worked closely with SIBIAM thereafter to support us in all our fundraising efforts and member activities and needs. As always, sustainability is a concern for non-profit organizations, and we are fortunate that our Vice President, Dr. Kribanandan, a Rotarian himself, decided to engage with several other Rotary clubs with the intention of increasing awareness and reach for SIBIAM. This led to the birth of DASH, District Action Group for Spina Bifida and Hydrocephalus in 2019, which has since brought in more opportunities for SIBIAM. And this year, we received the Rotary Global Grant. The main purpose of this grant is to have training programs for healthcare professionals and educators in multidisciplinary care of spina bifida. And our own multidisciplinary team of doctors and allied health professionals partnering with SIBIAM will assist in developing this program, which will then be carried out in several states over the next 2 years with the help of RCD and DASH. As we gain more support, we also face more challenges as the pandemic has spilled out yet another layer of issues to be surmounted, with increasing need for support for our members for social and mental health issues, financial issues stemming from unemployment, healthcare issues from interrupted health services, and of course, our own perennial struggle to raise funds to meet much of their needs. And so, we still have much to do, but we are truly grateful for this model relationship that we have with the Rotary. Thus, on behalf of SIBIAM, I sincerely wish to thank Rotary Club Damansara, DASH, and all the Rotarians who have come together to help us. I hope you will continue to be the threads that strengthen and support the fabric of our association in its quest to improve the lives and opportunities for persons with spina bifida in Malaysia. Thank you.
Right, thank you for that lovely video. Now we go on to the next poll question. Poll question number 2. Right. Okay, after all the presentation and video, now we want to assess how much do you know about SB or Spina Bifida. Yeah. 1, I'm confident with my knowledge in SB. 2, more than the average person on the street, but not an expert. 3, I have heard about SB before, but I don't know much about it. And finally, this is my first time hearing about Spina Bifida. Do you kindly assist us in this poll and submit your answers, yeah? Thank you so much. There's no right answer, no wrong answer, and certainly we do not have a prize for the correct answer for you. At this point in time, we could also acknowledge the presence of the District Rotary Foundation Chair of District 3310, past President Dr. Shahul Hamid, who has been a tremendous assistant and help to Dash in putting this global grant through, as well as the team from India, both President Rama and President Renu, as well as Rotarian Radhika from the Rotary Clubs of Ananaga and Chennai Towers, respectively. Thank you and welcome. All right, could we have the answers then to this poll? All right, very good. A third of us here are confident with your knowledge on SB. All right, later on we can give you a quiz. Now, and 29% more than the average person on the street, but not an expert. That sounds like me as well. And 23% have heard about SB before, but don't know much about it. And we have 15% who are the newbies and have not heard of SB. That's fine, that's okay, because when I volunteered myself, I didn't know very much about SB either. I thought it was special branch. I know of hydrocephalus, but SB was something new to me as well. But we all dived in as laypersons and we are there for the journey. All right, so thank you very much for your participation in the poll. And now we'll have, I'm going to introduce the next segment, which is now we'll have Dr. Kriban as the moderator. Right, and Dr. Kriban, who's been actually for the forum, he has been the driver of this whole action group, has been involved, as you all have heard earlier. And Dr. Kriban wears many hats. He's actually what I call an environmentalist engineering Spina Bifida man. Gosh, he's just wearing so many hats. Yeah, he's so active in environmental causes. He's the president of the Friends of Bukit Kiara, trying to make sure we preserve the greenness of the trees, and also now he's also involved in SB. And let's look at this visual summary that Tikka has done for us. Isn't that lovely? Wow, I wish that Tikka would help me with when I was doing my thesis and just summarize all that. That's fantastic. All right. Excellent. Making the connections and the next steps. Yeah, it's all there. Phase 1, phase 2, phase 3. And we'll keep all this definitely as part of the archives of the journey of Dash. So thank you so much, Tikka, for that. Yeah. All right, over to you then. Dr. Kriban? You're muted, Dr. Kriban. Yeah.
Sorry, yes, thank you so much for your very kind introduction. And yes, I think the imagery which Tikka just provided, I think really just conceptualized what we have already talked about now. And hopefully we'll have a few more of this as we go along. What we thought would be very useful to do is to give you a bit of an introduction, a further introduction to the SB condition. The way we have organized the next couple of minutes or next half an hour or so is basically we'll have 2 videos which we will show. The first one basically gives you a bit of a background about some of our stories or experiences from the younger SB members, some of the challenges of growing up and so on. Then once that video is done, we have a panel of doctors and I will ask a few questions. And then we will have a dialogue because so that we can get a bit of a sense of the issues. And then we will show a second video which will be looking at adulthood in SB. We have 2 of our SB members who will be talking about their challenges as adults. And then we will have another session with the doctors. And then finally, the last couple of minutes, if you have any questions, please come back to us on the chat box. we will try as fast as possible to then take some of your questions at the end before we go on to the final segment of our event. So without further ado, could I ask the tech team to maybe, yeah, thanks. Okay, yeah. So yeah, these are the contributors to the first video. Encik Rozaidi, who is actually a parent of a SP child and has some really interesting moving stories to tell us. Avina is one of our young adults. She has been with the SP Society for some time and accomplished herself, and you will hear about some of her challenges. Pei is also another of SIBIAM's members. And she also will share some of her experiences, her school days, and so on. And finally, Hamesh, who is in the committee of SB, and he will also share some of his experiences. So without further ado, can we just have the video, please?
Kami amat terkejut setelah mengetahui bahawa ada masalah kesihatan pada anak kami. Masa itu kami tak tahu itu ialah Spina Bifida. Pada umur setahun, dia telah menjalani pembedahan yang major, yang besar, iaitu membuang ataupun release stated cord di tulang belakangnya. Dan pembedahan ini merupakan ujian paling besar kepada kami kerana beliau terpaksa bertarung nyawa lebih dari 12 jam. Beliau telah ditolak oleh sekolah walaupun telah berdaftar di sekolah tersebut. Beliau telah ditolak dengan alasan beliau merupakan seorang OKU yang mempunyai kad OKU dan mempunyai kecacatan fizikal. Ini amat meruntunkan hati kami. Tetapi alhamdulillah juga, syukur kepada Tuhan, dengan usaha dan bantuan rakan-rakan, beliau telah diterima di sekolah yang lain. Dalam proses pembesaran, dia telah belajar ataupun dilatih oleh doktor, oleh jururawat, dan kami sendiri mendapat latihan ataupun maklumat dari rakan-rakan yang ada masalah yang sama dan mereka boleh hidup secara normal. Hanya kesedaran ataupun ilmu tentang Spina Bifida perlu disebar luaskan supaya semua masyarakat tahu, dan kemudahan-kemudahan untuk golongan OKU perlu ditingkatkan di sekolah dan di tempat-tempat awam.
Schooling for me was never easy. Unfortunately, there were so many government schools that did not have the necessary accessibilities that requires for a wheelchair bound like me. Making friends, that was challenging because as much as I was learning about my condition, it was a lot for another kid or another teenager to understand why am I sitting on a wheelchair. Why do I have white patches all over my body? Why do I wear special shoes? It was a lot for them to take in as well. So I'm very fortunate. I did have good friends that were very caring, very considerate. But I definitely would say that I found more comfort in making friends with my teachers that would take a lot of time teaching me, being there for me during lunchtime and whenever I need. So I would definitely say my closest friends during school days were my teachers mostly.
Starting with my late teens and early 20s. In those years, the word awkward appears almost always with regards to my interactions with friends, colleagues, classmates. They would not, how should I put it, not know how to approach a person with disability. As such, I would find myself making the first move.
The first time I feel in front of them, I would shy, and then like a princess, and then when I get along with them, I do not feel any stress, any pressure, because they really treat it as like normal person. So I also always pray with them, and then experience to join the singing competition with them, and then always going out entertainment with them, celebrate friends' birthday, and so on. So at the same time, my pre-university friends also encouraged me to join the activity from university, and then become as a committee member, and to share my experience to other person. I need to spend 2 or 3 months to suitable the environment there. Beginning when my parents know I want to went there study, my parents very worry about me.
My support system has always been my family, my parents, coming into a family where I'm the only differently able person. It was a learning curve, not only for me, but for my parents, for my siblings, and my extended family. So the support system, definitely my confidence, my self-esteem, it all started from them. Insecurities that I've had growing up would definitely be the weight, my body weight. I've always been on a bigger side, bigger body image. I've been fatter, I've been bigger when I was younger, so that was definitely where my insecurities were. And it was difficult to lose weight as someone who can't walk. There were very limited exercises that would allow me to lose weight, and not being able to fit into my favorite clothes, that was definitely a difficult thing to accept as a teenager. Having walking aids, that has always been a bumpy road, a bumpy process to learn for my parents and me on what's best for me in terms of my leg, my shoe aids for my feet, or the right wheelchair for my spine posture. We were always guided by many doctors and medical professionals, but I also feel like at the end it was a lot to do with our own research and our own learning process to see what's best.
Can I just invite our forum panel doctors? We'll just have a short question and answer before we go to the next video. We are really very fortunate to have, of course, you've already been introduced to Professor Dr. Amara. She's been with us already. But we also have Professor Dr. Noor Ahmad Bahuri, who is a consultant neurologist, neurosurgeon, and he will be giving us some insights into care for SB children. And we also have Dr. Poorani Anandakrishnan, who is a consultant, who is a consultant pediatric and pediatric neurologist with us. Thank you, Dr. Noor, Dr. Poorani, and also Dr. Amara for being here.
Thank you.
Yeah, if I may just begin, it is quite clear from the anecdotes we just heard that there are some real challenges with having a child with Spina Bifida. Maybe to start with, can I ask Dr. Faizal, presumably from what we heard from the parent who was talking about early operations and so on, can you tell us about some of those surgical interventions which are required? And is it safe for these to be done on babies at such an early age? And what are the ramifications of that?
Right. Assalamualaikum warahmatullahi, and very good morning to everybody. Thank you for having me in this forum. Okay, so to answer that question, it is safe to do operation even for day 1 old child because the child need that operation. So we will try as much as we can to support the child, but rule number 1, the child need operation because we have to save the whatever nerve that is available on the at the back there, and we have to close that nerve because there's something about the nervous system. It cannot be exposed to air. The moment it touches the air, it will die. So in spina bifida, the most severe form is the open myelomeningocele, and we need to. I don't have because of my background, I can't disable my background. Yeah, because in this setup, the kid will need, number 1, close the spinal defect and close the neural tube. Then number 2, we have to probably do an operation to divert the fluids from the brain because our nervous system is suspended in the fluid called cerebrospinal fluid. In bahasa Melayu, they said air tulang belakang. So air tulang belakang produces in the brain, goes into the spinal cord and being absorbed. So for the wound to heal at the back here, at the spina bifida, the fluid should not break that barrier, because if it break, then the wound will get disrupted. So number 1, the kid need a emergency repair at the spinal cord. Number 2, we have to divert the fluids either by a temporary or permanent solution like VP shunt. And subsequently, there are many other operations or procedures that the child needs. So usually I will tell the parents, because I am the first one who will manage the kid. I will tell them, I will advise them that this operation is the first of many procedures. This is a long process, a long journey for the kid from day 1 until they are adults. So as you have seen in the videos, they have faced several challenges and they are still facing it. So it is our role together to build this system from day 1 to they are old. Okay. You're muted, Dr. Kriban.
Sorry. Yeah. Okay. Thank you. Thank you again for that very comprehensive, view of the issues. So I think we've heard this before also from Dr. Amara's presentation earlier. So there are many different types of SB, of course. So maybe I could turn to Dr. Poorani and maybe tell us a little bit more about the complexities of this. Of course, some kids have, even in the video we saw, for example, PE is able to walk and so on, whereas Avina is in a wheelchair and things like that. Can you tell us something about that? Why those differences?
Good morning. I'd like to thank the committee for the opportunity at this forum again. My name is Poorani and I'm the neurologist. So 3 commonest types of spina bifida from the mildest spectrum, which is the spina bifida occulta. Mildest form with a very small gap or protrusion in the spine, then becoming the meningocele, where there's protrusion of the spine with a protective membrane covering the surrounding sac. And then you have myelomeningocele, which is the most severe form, where there is a defect in a complete exposure of the spine and the lower nerves to airs that Professor Faizal's mentioned. So functioning and mobility is basically dependent on these types, and the spinal level of is affected. So the higher the spina bifida location, there are more disabilities that you would see in a person.
Thank you, Dr. Poorani. I think that's sort of encapsulates the kind of the differences we're dealing with. Dr. Amara, Professor Faizal talked about all these early interventions. As a rehab physician, do you get involved at an early stage as well in terms of rehabilitation of kids at a very young age?
Yes, absolutely, Dr. Kriban. The rehab team consisting of the rehab specialists and therapists are often on board very early on. You see, because children with spina bifida also come with some deformities of their foot and limbs. So very early on, we need to step in to teach parents on, some therapeutic exercises. They might need some splinting, and especially if they're undergone surgery, they'll need post-surgery rehabilitation. So our connection with them is often quite early, and when they are discharged, we continue to ensure that they come in for regular therapy, where we can weekly, but at least a couple of times in the month. This is very important because the post-discharge period can be very worrisome for the family. While in hospital, they have all the doctors, everybody around to help them to take care, to allay their fears. But once they're at home, they are all alone, they're on their own. And so it's important that they continue to have that link to the medical community. And it's often through our allied health colleagues wherein they come for their regular therapy. And, a lot of times it's during this therapy sessions that, having trained therapists is really a boon, because they're able to pick up subtle things that the parents are undergoing. Parents may say, my neighbor said I should go to the BOMO, or I should go to the a healer and things like that. So, it's not that anyone of us are being judgmental about it, but we just give them the advice about what they need to be cautious about in doing so. So, when the child has some pressure ulcers that the therapist notices, so the child is quickly brought back into the system. So, so yes, we are there from the beginning and into the childhood, adulthood, and beyond.
Yes. Thank you, Dr. Amara. Thanks for all the work you're definitely doing. Just to move on, maybe Dr. Faizal, I remember in the video with Rosidi, he talked about this condition called the tethered cord syndrome or something. Maybe you could tell us a little bit about that. What additional issues are there in this this problem? Yeah.
Sure. So tethered cord is, as Dr. Poorani said, is one form of the spina bifida. So tethered cord means that the spinal cord has been pulled out. Just to highlight, just to show, the spinal cord should end around the L1 or L2 lumbar area. Okay, in some kids, at the end of the spinal cord is attached to sacrum. This is like a guiding post for the spinal cord to grow, but somehow that area persists into childhood, and it can pull the spinal cord. Just imagine if this is a string, it's like for our mask. Okay, if it's been pulled down, and if you don't release it, all the other nerves will get affected, being pulled down, stretched. And like all the stretch properties, once it reaches to the maximum capacity, it won't come back. So in children, I would suggest to do the operation less than 1 years old, because we want to give them the idea of some benefit of the doubt. Release the tethered cord, snip it so that the spinal cord can bounce back to its normal position, and we can hopefully try to preserve as much as nerve as possible. And then Dr. Amara and other health alliances can help try to get the strength, try to get all these remaining function to its maximum capacity. So catheter cord can be part of the disease. So in spinal bifida, in myelomeningocele, as they reach adulthood, that area that has been operated on day 1 or day 3 of life may get attached to the spine area, and usually they present quite late, about 20 to 25 years old. They come with growing pain over the back area and sometimes weakness. Then we have to redo the operation just to release the attachment.
Right.
So it is a complex surgery. That's why we as a group, we would like to follow up the patient as they go older, because at different stage they have different problems. Yeah. So
right.
Coming back to you, Dr. Kribanandan.
Thank you so much. Thank you so much for that very detailed explanation. Maybe one more question before we go on to the next video. Dr. Poorani, I think one thing which seems to be coming through also over the years I've been involved is the issue of urinary and bowel control, which seems to be affecting a lot of our SB clients. Why is this so? And can individuals achieve some kind of control with this? Could you say something about that?
Yes. So the nerves supplying the bladder and bowel are located at the bottom of the spine. So these, when they get affected with the spina bifida in any form, causes the bladder to either hold urine or leak, as well as the bowel to have incontinence as well, or constipation. So for the bladder, we use intermittent bladder catheterizations. That means we put in a drain intermittently throughout the day, either 4 hourly, 6 hourly, depending on the advice given by the nephrologist. And then this is to drain urine. And for the bowel irregularities, we tend to use a lot of laxatives to ensure proper clearance of the bowel and adequate bowel clearance. So sometimes they might need diapers throughout the day as well if they are having too much of leaks. And in bigger children or in adults, then we advise for the stool plug. Yeah, so this can be a lifelong issue, and with daily clearance, appropriate care, appropriate information given to these patients, we think that there's not much complications and side effects throughout their life.
Thank you, Dr. Poorani. Look, we'll have to leave it there for the time being. We'll come back to you guys after the next video. Can I get the tech team to show us the next segment, please? Okay. In the next segment, we have two members of the SB community who will be talking about their lives. Tengku Ari, who is in our committee, our SIBIAM committee, and has got some moving accounts of his life. And Dr. Yang Mieng was the founding member of the SIBIAM with Dr. Amara, and she has moved on in terms of career, and she will also be telling us a little bit about her background. Please go ahead.
Hi, my name is Tengku Ari. I was born with Spina Bifida in 1979 and had a spinal cord surgery during my infancy. One of my testing moments in my adulthood is marriage. However, it only lasted 6 months. My emotional depression was quite high at that time, and not long after, I eventually met someone new and who is much more understanding, and who happens to be a nurse, and she is the most wonderful, caring, supporting wife, and a very good life partner. One of my challenging moments in that time regarding my CISC is finding the supplies of catheters around my town and my area of stay. Sometimes stock is always not available, and I would have to travel quite a distance just to locate a place that has the available stock. Over 10 years or so, prolonged period of performing CIC, I eventually was diagnosed with end-stage renal failure, for both kidneys. And now I am currently doing hemodialysis in my local hospital. I experienced a neck of femur fracture, which I had to undergo a total hip replacement. Was on the wheelchair for 6 months and went through physio rehab. After about a year, I was able to regain back my walking abilities, but permanently I have to walk with a walking stick. My hopes as a spina bifida person and all the other like me is to be able to fulfill their ambition in life. I used to try and fit in with the society, but now I can see that we as a person need to fit in ourselves with our own abilities, because there are many paths that will lead to where you want to go, and eventually there will always be obstacles. And whatever the obstacles is, you can always work your way around it. Each and every one of us is very unique, and we have our own special abilities.
Hi, I'm Young. I'm a person with spina bifida. I have lived more than 5 decades. Family love and family and siblings and friends are very important for spina bifida person, because by having encouragement from friends, family, I have very good family support. You know, my siblings, we are very close. My mom and dad love me. You know, they give me a lot of space, and in fact, they don't limit me from doing what I want. As a spina bifida person, we are no different from any other people, because our brain works normal, like normal people, you know. So only our physical has some differences, some physical limitation and challenges. But if we manage it properly, even with a wheelchair, we can go somewhere. You know? So do not don't stop having dreams. And when it comes to career, for me, it's education is very important. Okay, for those of you who is not your learning ability, if it's there, you know, just continue learning, continue to study, you know. So for me, I did I completed my PhD at a very late age, late 40s, and I completed and achieved my dreams, and that opened up a lot of opportunities for me. So now I'm actually given an opportunity to lead, to be the executive director of ASEAN Foundation. My office is based in Jakarta. So I'm doing a lot of NGO work, non-profit organization. ASEAN Foundations takes care of people, community in ASEAN country, 10 ASEAN member states, 10 ASEAN countries. So if I can do it, I believe all of you can do it, you know, if given some encouragement and opportunities. So do not stop dreaming and achieve it. You know, when you have a dream, please achieve it. Please try to go for that dream. For all the parents out there who have spina bifida child, don't feel too sad. You know, try to do the best. You know, prepare your child, give them what they need to survive in the future. Don't be too worried about what will be the next path for them. You know, they will figure out one day when they are matured enough. people, please join Spina Bifida Association of Malaysia, SIBIAM, because I founded Spina Bifida Association with Dr. Amara, Professor Amara, and I see that under the leadership of Professor Amara, the Spina Bifida Association has gone to another level, higher level, creating more impact to the community. So, when we are united, when all the families are together, we have peer support, we can share with each other our experience, and we can manage better. We can give a better environment, prepare a better ecosystem for Spina Bifida people to grow to their fullest potential. So all the best.
Thank you. Thank you. Yeah, we are back to our forum panel doctors. Maybe a few questions. We are actually slightly behind the schedule at the moment. So let me I think we've seen some of the challenges associated with the SP condition, particularly in adulthood. Things like renal failure, surgical interventions, and so on. So, Dr. Amara, I think maybe the question to you is. It seems like this is a lifelong issue, and there are a myriad of health problems with age. Why is this so, and can this be avoided in some way? Are there things you can do to minimize the issues? What's your take on that?
Yeah. So, well, to start off with, they actually are having lower reserves. I mean, they already have some bladder bowel issues, musculoskeletal problems. So, so sometimes these issues can escalate as they grow older, especially if they've not been undergoing appropriate treatment. But for those who have been sort of following up, they can still develop other lifestyle disorders like diabetes, hypertension, and heart problems that can compound their existing problems. So it is an onward journey. At every point, it's important that they are in close connection with their healthcare professionals. And of course, the community for other support. And yeah, I mean, they too face the same risks as everyone else as they age: sedentary lifestyle, food choices, stress, etc. Yeah.
Thank you, Dr. Amara. Yeah, I think, maybe, yeah, actually, I have quite a few other things I'd like to discuss, but maybe in the interest of time. Maybe you could say something about the role SIBIAM has played. I mean, how important do you think this is, and how do you see the organization going forward in terms of the kind of interventions we're looking at?
Well, sure. So as you can see, there is a need for peer support, and that's why in the organization that's what we try and do. In other words, borrowing from the current theme, Kita Jaga Kita. So we want our people, all of us, to be taking care of each other, and we hope that SIBIAM would one day, become something of a one-stop center, wherein we have everything related to SB being available there, be peer exchange among parents, advice on how and where to seek appropriate help, guidance and support for educational and vocational training. Because we have a lot of members who may not actually make it to a degree program, and anyway there are a lot of unemployed degree holders also. So so we want to try and engage them in activities that can be useful and of interest to them. And that's why we are trying to get more of our younger members to form the youth wing within the organization, and we have also gone the extra step to connect with the International Federation of Spina Bifida and Hydrocephalus, as well as the Indian Spina Bifida Foundation of India during our last meeting. So we hope that our members would also, join in and learn how to, share, connect, and grow together with the international members with Spina Bifida. Because end of the day, you can't be very local in your thinking. There may be other things that people outside can teach us or share with us. We are also running public campaigns to educate families and the general public. And more recently now, we are working to create awareness amongst the medical fraternity and educators so that we can identify SB-related health issues early on and work together as a multidisciplinary community. And we hope in the near future to bridge our services seamlessly with that of the healthcare system, social welfare system, and possibly the educational system and even the corporate world, so that there are some clear possibilities and directions for our SPP persons in the coming years. As you can see, some of our members have made it, so it's not impossible. So given the right support, we hope that everyone will come in to help make this difference over to improve the overall quality of life and the future of our SP children and adults.
Thank you so much, Dr. Amara. I think on that note, we will need to move on. Thank you again, Dr. Amara, Professor Dr. Noor, and also Dr. Poorani for sharing your time with us. That's been fantastic. We will be calling on you, of course, a bit more in the next coming months. And also our forum, our SB family, who have been so kind to give us share some of their very personal moments in this journey. If I may, we will just move on to the next question, which is our poll question number 3. Can the tech team put that up, please? Yeah, this poll question number 3 is talking about complications. Goodness, I seem to have lost the screen. Can we go back to that? The questions? Anyway, hopefully you can see the questions. Try and answer them as quickly as you can, and then we will have a bit of a background. No, I can't see it at the moment. Not to worry.
We have the tech team to put back the slide.
I can't see either. I can't see either.
Oh, you can't see it. Huh? Can we put that back on, please? That's it. Okay. The question is, in spina bifida, the person may experience the following complications. So I think you've heard about all of this in the last, an hour or so. See what you think is the appropriate answer.
I think it's not the question. It's the
this is the okay.
This is the answer.
Can we go back to that, or if it's not to worry, we can move on. I think
we can move on. Yeah.
Let's move
okay.
On. All right. Okay. Yeah. Quickly, guys, just answer the question, and we will just get a bit of a response. Following this, what I will do is I will share another visual image from Tikka on basically the what we've been discussing with the forum and so on. Basically, living with spina bifida. So this is a graphic image of some of the discussions we've already had. That's been fantastic. Okay, we can see in terms of the. So I think, the majority of us have basically said all of the above, which is obviously the correct answer, because all of these things are conditions which affect SBS. So that's been great. I think we obviously have got some of that message across over the last hour. So thank you, Tikka, for this wonderful summary. What we will do is you've seen the first summary from Tikka and the second one. We will post this into the chat box so you can take it away. And then once we do the final one, we will do a summary later. And those of you who have joined or is interested, we can send you the final version of the summary in a pictorial form. I think this is a great way to conceptualize, what we've been discussing. Can we then move on? Yeah, I'd like to say something about the International Federation. I know Professor Amara just touched on it. The International Federation of the Spina Bifida and Hydrocephalus was set up in '79 or so. And they have over the years become quite a central organization linking together the various SB organizations around the world. We are also a member. Our Spina Bifida Association here in Malaysia is a member. And we were very fortunate about in 2019, I think it was, that we attended the International Federation conference in New Delhi. It was a great sharing. You can see on the bottom right there, some of us who went, Dr. Amara, Dr. Young, Avina and her mother and her sister, and myself. We went, and it was a very good session of sharing and so on. The IFBH, if anybody's interested, have got a website. They've got a lot of very useful information. So next slide, please. I also, spoke at their first online event last year because, we couldn't have a physical conference. Dr. Sylvia Roozen is the Secretary General of the International Federation. She's very kindly, of course, the timing was very bad for her. She's in Belgium. So she's very kindly sent us a message by video. Please play that. Yeah.
Dear President of the Spina Bifida Association Malaysia, Dr. Naicker, and dear Chairman of the District Action Group Spina Bifida and Hydrocephalus, Dr. Kribanandan, dear sponsors of the Rotary, dear organizers and delegates. As Secretary General of the International Federation for Spina Bifida and Hydrocephalus, I'm sending you the best wishes from our head office in Brussels. It's so nice to see each other in this digital way, and I trust also in good health. It's good that not too long term from now, the in-person meetings can take place again. So I look forward meeting each other soon. Today, it is an important event whereby we, together with you, reflect on a health concern for people born with spina bifida and hydrocephalus in Malaysia. And it is also about actions that we can take together to really make a difference in the upcoming years in terms of optimizing management and integrated care through a training program. The launch of the training for healthcare professionals and special needs teachers on the management of spina bifida is an excellent step to make integrated care a reality in the SBH communities in Malaysia. It's great to see the many volunteers involved and also the interest of many. With this program, you can, in a systematic way, really contribute to lives of many and improve the quality of life in multidisciplinary care settings. It is therefore a pleasure to be here with you today and learn from you. Compliments for the work you are already doing. The meeting today is an important and also inspiring step forward. Wishing you a fruitful meeting and also a successful way forward for the workshops to follow. Each one of us can make a difference. Together, we can make change.
Thank you. I think that was a lovely message. I'd like to invite PDG Leslie Salehuddin back to introduce none other than DG Bindi.
Okay, thank you very much, Dr. Kriban, for your capable sharing of the or moderation of the forum. Now it's my great pleasure to introduce our district governor, who has been waiting quietly in the wings. Our district governor, Dr. Bindi Rajasegaran, hails from Seremban, but has actually migrated up north to Bin Ipoh, and now she is a member of the Rotary Club of Greentown. And I must say this, that our governor has actually started at a frenetic pace. In fact, she's done so much even before she took office. So I think as Rotarians and a district, we have a tough act to follow her and to keep up with her. She has done many initiatives even before she became governor, one of which was a fantastic exercise in both districts on real heroes in recognizing the KTM staff of both districts, and as well as engaging with the UNHCR and the World Bank on the Forum for Refugees. And now she is going to take us on a mental pace. She is also aggressively pursuing the agenda on mental health. And with those few words, it's now my pleasure to invite our governor to say a few words and thereafter to officially launch this district, our global grant. Over to you, Governor.
Thank you so much, PDG Leslie, for those kind words. Good morning to everyone. I know salutations have been done, but kindly bear with me to recognize the following. Immediate past President, Engineer Dr. Kribanandan, Chairman of the District Action Group of Spina Bifida and Hydrocephalus, District Governor Budi Syohardi from Indonesia, my classmate and now good friend, President Shandra, the Rotary Club of Damansara, the host club of this global grant, President Ramakrishnan from Rotary Club of Chennai Towers, India, President Renu from Rotary Club of Anandakrishnan, India, past Governors Leslie Salehuddin, advisor to DASH, past Governor Eva Kurniati from Indonesia, past Governor Dr. Bhaskaran from our own district, past Governor Siti, who is our current foundation chair, past President Dr. Shahul Hamid from the Rotary Club of Singapore, who played a role in this grant as well. And he is also the current foundation chair of District 3310. District Governor-elect Dr. Krishna Kumar, Dato Dr. Musa Nordin from Damansara Specialist Hospital, KPJ Group of Companies. Our distinguished panel of speakers, Professor Dr. Amara, who is also president of SIBIAM, Dr. Poorani and Dr. Nur Faizal. Our fellow Rotarians from India, Singapore, Indonesia, and Malaysia. And our most honored guests, the parents and healthcare professionals here on this call today. I welcome all of you. On behalf of all the Rotarians in District 3300, the healthcare professionals and parents and children involved in this initiative, allow me to express our heartfelt and humble gratitude to the members of the Rotary Club of Damansara, District Action Group of Spina Bifida and Hydrocephalus, and the Spina Bifida Association of Malaysia, who have so selflessly dedicated their time and resources on a subject that is so meaningful. Spina Bifida and Hydrocephalus is a very specific subject and not often addressed as a cause by organizations. So it's a proud moment today as we witness the launch of this strategically focused and high impact global grant that will provide the much needed awareness and solutions to address this subject. I remember 3 years ago in the early months of 2019, I was having a chat with Dr. Krib when he was president-elect then, and he was sharing his plans to apply for the global grant in this subject. And it just takes one person with focus and total passion to enlist the trust and support from others to make it happen. And Dr. Krib has been able to do just this from so many clubs within our district and from other districts, namely 3340, represented by Rotary Club of Anandakrishnan, Madras, and Rotary Club of Chennai Towers, and of course, Rotary Club of Singapore. Thank you, PP Dr. Shahul and past Governor Leslie for your support. Credit too to the members of the District Action Group who have steadfastly supported this cause since their first interest meeting in 2018. And thereafter, DASH was launched at the 84th District Conference in Butterworth when past Governor Dr. Bhaskaran was the governor. And I'm totally not surprised by the exceptional speed with which this grant was approved. As knowing Dr. Krib, he is very meticulous in providing the right information, ensuring everything is perfectly well thought out before submitting. So well done. And this is a fine example of the greatness of our Rotary Foundation. Every cent received in this grant is from Rotarians from all over the world who continuously and passionately support the foundation for reasons such as this project. Our foundation is the heart of Rotary. I'm also full of pride that we as Rotarians are addressing an issue that is so heart-wrenching to learn about. How the parents feel when they realize their future is born with this condition. Could it have been prevented? That's part of this awareness program that may highlight this issue, and parents will take heed. However, while we wish and pray no parent has to experience this in their newborn, the reality of it says that there will be children born with such conditions. And with this initiative, we are ready to give them a better future. But spare a thought on the mental well-being of the growing children and parents as well. Parental stress in families who are raising children with spina bifida is higher than in the general population, particularly among mothers, single parents, older parents, and economically disadvantaged. Their mental well-being needs to be supported, and we have a strong structure within Rotary in providing this as well. It takes a lot for such parents to accommodate the needs of such a child, and it takes a toll on their mental strength, financial abilities, and the cohesion among other siblings and the family resilience. And we just heard from some of the testimonials today, family support is so important. As a mother and grandmother myself, I feel what these parents go through. They need support. I read many success stories of enriching lives of children with spina bifida, and I'm convinced that with this grant, we will be able to hear of more success stories and make their dreams come true. Now it gives me great pleasure to officially launch the global grant to train healthcare and special needs teachers. I wish you all a very successful delivery of the program with exceptional results. Thank you.
Thank you, Governor, for your very thoughtful address and in launching the global grant officially. And now for a word of thanks with our co-chair, past Assistant Governor, Dr. Selva, to say a few words. Over to you, Dr. Selva.
Thank you, PDG Leslie. A very good morning to all present here, and Honorable District Governor, Dato Dr. Bindi, Rajasegaran, the Rotary dignitaries from our district, District 3300, 3310, from Indonesia and from India. It gives me an immense pleasure to deliver the word of thanks on the occasion of launching Global Grant for DASH. And my special thanks goes to our district governor, who, despite her busy schedule, had agreed to come and launch our Global Grant. And her speech has inspired us to do better. I would like to mention a few of the individuals that supported us. First of them on the list is Dr. PDG Leslie. In fact, PDG Leslie was the one who, I think one of the meetings, in one of the kopitiams, that he said DASH is a very nice acronym, maybe DASH, and we stick to that actually, DASH. Thank you, PDG Leslie, for inspiring us and guiding us for the last 3 years, and we need your help for the coming years. For PDG Dr. Bhaskaran, he was the one who launched the DASH in 2019, and followed by PDG Leo, who continued support, and culmination of the global grant during DG Bindi's year. I would not fair not to thank our partners, SIBIAM, and also all the Rotary clubs in District 3300 who have contributed to the global grant, and also in 3310 Rotary Singapore, Rotary Club of Anandakrishnan, President Renu, and Rotary Club of Chennai Towers, President Rajasegaran. Thank you for your support. We are looking forward to work towards making DASH a better and recognized both locally and globally. I would like to invite, as far as I've known, that DASH is the only district action group for Spina Bifida and Hydrocephalus in Rotary, similar to autism. And both these were started by District 3300. I would like to invite the other districts to do similar and join us in making lives of children with Spina Bifida and Hydrocephalus better. And finally, I would like to conclude my word of thanks with gratitude is the least articulated emotions when it's deeply indicated. With that, I'd like to thank the organizing committee for the great job done. Thank you.
Thank you, PG, Dr. Silva. Now we have Dr. Amara to introduce the video on Spina Bifida, The Journey. Over to you, Dr. Amara.
Thank you. Yes, as we near the end of this program, on behalf of Spina Bifida, we are excited to share with you our incredible journey of challenges, growth, and transformation that we have been through in all these years, all of which was made possible through your continued love and support. And as we move into another phase of growth, we hope to have more of you to be part of us and to hold hands with our parents, with our children, with our adults with Spina Bifida as they make their journey forward. Thank you.
All right, thank you so much, Prof. Amara. Now we come on to the last of our poll question for this morning. How would you like to assist SIBIAM Dash in this initiative? 1, wow, financial contribution. 2, if you could volunteer some time and to help us with your service. 3, you're still unsure but interested to learn more about how you can help. And finally, I'm unable to assist SIBIAM Dash at the moment. That we understand, no issues. So could you just help us with the poll, please? Thank you. And while waiting for the answers, I must add to what PJ Dr. Selva has mentioned, we have outreached to now District 3310. We have got a few representatives here today from Johor. We are so happy to have Simon with us, as well as Christina and Goh Yising and Wang Chin Wang. So welcome to the family of DASH, which we'll want to extend to District 3310. And of course, we have now Dr. Yang in Jakarta, together with Governor Captain Budi, as well as past Governor Eva. We may even do an international outreach to Indonesia as and when our roots are firm and we are a little bit more established, yeah? Certainly that's something in the pipeline. All right, so could we have the answers, please, to the poll? Thank you. Thank you so much to the 5% of you who can support us financially, whatever amount we will appreciate. Time and service, fantastic. We got about 60% of you able to help us in time and service. We will come to you in a minute and you can please volunteer and link up with us. Still unsure, 32%, don't worry. We'll try to convert you even more with more activities of DASH. And finally, not able to help us, it's okay. The 3% of you, as I said, everybody has got different agenda and we are very appreciative for your warm response and thank you so much. All right, great. Now, it gives me great pleasure to invite our district governor-elect. He's the man who will take over as of 1st July next year. This is our Dr. Krishna Kumar, who is actually a medical doctor by training from India, but he has been in a hospital administrator for many years, covering many government hospitals, both here and in Sabah as well. So Dr. Krish, over to you with your closing remarks. Thank you so much, sir.
Thank you, BDG Leslie, for that introduction. DG Dato Bindi, Rotary leaders, current, past and future, my Rotary friends, and all present today. I have been following the remarks, the progress of the District Action Group on Spina Bifida and Hydrocephalus, DASH, and I am awed by their achievements. DASH was set up as a special interest group only in August 2018 and was formally recognized only on 3rd May 2019 at the 84th District Conference in Penang. Yet, within a span of only 2 years, they have managed to successfully plan and obtain approval for a global grant. This is a remarkable achievement, not only for DASH, but also for Rotary Club of Damansara, the host sponsor club for this global grant. Well done, my friends. Today, we have heard a very educational talk by all the 3 doctors, and we have learned a lot, and a very touching testimony by the Spina Bifida individuals here today. You have done a very good launching of the global grant. Now comes the implementation, which, seeing the impressive lineup of your committee members, I am sure will be carried out smoothly as you train the trainers who will in turn create awareness among and educate parents, caregivers, teachers, and the public about the management of Spina Bifida patients. The impact of this global grant project will be far-reaching, and it will significantly change the lives of Spina Bifida patients all over the country. You will serve to change lives. I call upon all Rotarians and Rotary clubs in our district to provide any assistance required by DASH and Rotary Club of Damansara for the successful implementation of this project. I further urge all Rotary clubs to learn from the experience of RC Damansara in working with DASH to apply for a global grant. If they can do it, so can you. It is our fervent hope that more Rotary clubs in District 3300 will apply for global grants, either singly or in groups, to carry out significant, sustainable, long-term projects that will make a lasting impact on the lives of people. Lack of funding should never be an issue, as the funds can easily be sourced. Where there is a will, there is a way. You just need to identify a cause that you are passionate about and put your heart and soul to make it a success. Go for it, my friends. Lastly, I wish to congratulate all the members of the District Action Group on Spina Bifida and Hydrocephalus, the members of Rotary Club of Damansara, the Spina Bifida Association of Malaysia, and the partner organizations and individuals who have worked so hard to secure this global grant. I wish you all the best as you serve to change lives. With that, my friends, I formally close this launching of this global grant project. Thank you. Over to you, Leslie.
Thank you, DGE, for your closing remarks. But before we officially close, I'll be remiss if I didn't recognize just two more partners from District 3310. We have Dr. Asohan from Rotary Club of Likas Bay, who's here with us, and also President Prakash from Rotary Club of Pasir Gudang. So welcome to our group. This is now a larger family. And now I'd like to hand over to the Chairman of DASH, IPB, Dr. Kriban, to officially wrap it up and close. Thank you. Over to you, Kriban.
Kriban, your microphone.
Yeah, thank you so much, PDG Leslie and DG Krishna for that wonderful closing. I just have a few things to do now. One is to also recognize all the people who've been involved in this, getting this together. But first, can I just share with you the next visual image from Tikka on the last segment of our meeting. So here we are. We're talking about the roles of partners in the SB journey. So you can see that we have certainly brought together quite a varied number of people together. But we will share all of this with all of you in the coming period. Can I just move on to thanking or showing our appreciation to some of the people who've been involved in pulling this together. Next slide, please. So yeah, I think we've seen our forum participants. I think they've done an amazing job to share their very personal stories. And you'll be, if you're involved with the SB community, you'll be seeing many of them in many of our events. Thank you to all of you for sharing your personal journeys. And of course, our forum panelists, doctors who are very involved with our session earlier. Thank you so much for coming on. Special thank you to Leslie, PDG Leslie, for being the MC and doing all of this together today. And of course, Professor Dr. Amara. Special appreciation to our clubs, our international partners, without whom this global grant would not have been possible. So with that, thank you so much, everyone, for being with us in this journey. We have a couple of more minutes. Obviously, we can do some fellowship, but hopefully we will be seeing all of you in the coming months to take the global grant forward, and I look forward to that. Thank you. And here, this is the support team who have put everything together. Thank you, Dr. Bernard, Mahesh, Tunku Ari. Has been fantastic that you've been able to bring. And we also had Millie, who put together the videos and so on and so forth, and Tikka, who did the visuals. So the faces of the global grant are set out here. We've been doing quite a lot of live webinars with SIBIAM, together with SIBIAM. I think, and there's one coming up next next month. And hopefully you can all join us and start to make a difference. So this is the upcoming one in August. So we are doing these monthly webinars. So do try and join us. We have some amazing doctors who have been volunteering to work with us in this journey. Thank you again, and we will be meeting soon and drawing on support from you as we go along. Thank you.